RCSI was the first medical school in the Republic of Ireland to introduce a graduate entry medicine or GEM programme in 2006, enabling students from a range of undergraduate backgrounds to study medicine.
This accelerated programme is designed for students with an undergraduate degree who wish to return to education and pursue a career in medicine. RCSI's graduate entry medicine curriculum is innovative, future-focused and integrated.
The programme is centred around our students and delivered in our state-of-the-art healthcare education facilities in the heart of Dublin. From day one, we also put intensive focus on the acquisition of clinical and communication skills, as well as understanding the central tenets of personal and professional identity formation. They are professionalism, resilience and leadership.
This ensures that upon graduation, students are career ready and will be prepared for a personally and professionally demanding career in tomorrow's healthcare environment.
I think what struck me the most about RCSI was the huge emphasis they place on early clinical exposure. What underpins our success as future doctors is our ability to effectively communicate with both our colleagues and our patients. And I think having that early clinical exposure is such a massive asset.
RCSI does a very good job of incorporating a lot of patient interaction very early on into the medical education.
It's a healthcare sciences specific university, and having come from a really large university for my undergrad, I felt that a slightly smaller, more specialised university would benefit me.
From having dedicated college supports like a careers department to having a really diverse student body, it's really visible that student voice is something that's important in the decisions that are made there.
RCSI, my interview felt the most conversational. It felt like they were interested in me before I was admitted.
I was looking forward to having an international class, and that's exactly what I've received since I've arrived here at RCSI.
Year 1 teaching incorporates a combination of lectures on the biomedical sciences and small group teaching related to weekly cases. Teaching includes facilitated case discussions, data interpretation, tutorials, clinical skills training, group projects and anatomy practical labs. Students learn to take and present a history from as early as the 3rd week of the programme. At the end of the 2nd semester, students spend the last month of the academic year completing their clinical attachment at one of the teaching hospitals affiliated to RCSI.
In Year 2, students are based full-time at Connolly Hospital Blanchardstown, which is one of the main RCSI affiliated teaching hospitals in Dublin. In addition to lectures on pathology, microbiology and clinical sciences, students also participate in small group tutorials, classroom award-based on all aspects of patient care, including history-taking, clinical examination, radiology, data interpretation and therapeutics. The last 10 weeks of the academic year comprise of clinical attachments, providing students with the opportunity to become an active member of a clinical team within the hospital.
In years 3 and 4 of the programme, the majority of teaching is hospital-based, where students are attached to consultant or attending physician-led teams. In the 3rd year of the programme, students study paediatrics, family medicine, psychiatry and obstetrics and gynecology, along with medicine and surgery. The final year of the programme concentrates on medicine, surgery, anaesthesiology and preparation for practice.
RCSI GEM students enjoy many opportunities to build their careers via undergraduate research opportunities, overseas clinical electives in prestigious institutions, and a 4-week sub-internship programme in final year, in which they work as a resident in training in a hospital in Ireland, the US or Canada.